today, Dr. Nathan Bryan has graciously agreed to come and talk to you guys about nitric oxide. And he is literally the man who wrote the book on it. And you may have seen that. We do sell this book on our website. And so we have his book. We also carry a Neo 40, which is a product that he developed, part of developing, and also Nume, which is a nitric oxide skin product. And if you don't know anything about that, I'm sure Dr. Bryan will share with all of that. So without further ado, I'm going to let you take it over.
Thank you, Janice. And thank you, everybody, for taking time out of your Monday evening to spend a little time with me to update you on some nitric oxide. So, I just want to start out by thanking you, Janice, and Scott, and Terry, and really Dr. Tennant. I can confidently say that there's not a single person who's had a bigger impact on my health and my family's health than Dr. Tennant. So I owe a debt of gratitude to him. And I've learned so much from Dr. Tennant over the past, 10 years. I met Dr. Tennant almost 11 years ago. Became really close friends. But really, I think the most important thing is the teachings that he's taught and really bringing together the basics of cell biology in a very practical way that patients and healthcare practitioners can basically make patients better. And so I'm very honored and to be a part of that in terms of nitric oxide. And so what I thought I would do is just start out, because if you've learned nothing more than this single slide, then this is the take home. The nitric oxide deficiency causes chronic disease and increases sickness and mortality from viral infection. And that's very pertinent in this time of COVID. So the most important thing you can do is improve your body's ability to make nitric oxide. And that's my objective over the next 45 minutes, is to teach you a basic understanding of nitric oxide biology, and then give you enough knowledge and information that you can properly inform yourself or your patients on ways to improve nitric oxide. And so really, I've been doing this for more than 20 years, between 20 and 25 years, really. And my lab and research program is really set out to answer 4 fundamental questions. How does the human body make nitric oxide? What goes wrong in people that can't make it? What are the clinical consequences? And then perhaps most importantly, how do you fix or restore it? And so this has resulted in dozens of issued U.S. international patents, published hundreds of peer-reviewed papers, hundreds of lectures worldwide. And that's also led to a number of commercialization projects. I have a number of conflicts of interest that are hard to share with you. I'm the founder and chair of Nume, the makers of Neo 40. Nitric Oxide Innovations is a drug company. We're in phase 3 clinical trials for a COVID drug that I'll share with you some really exciting data on. And then the founder and CEO of Nume Nitric Oxide will develop a topical nitric oxide technology. And then I receive royalties from the University of Texas. And just let me, if you're just joined us and you're not muted, would you please mute your line? There's a little bit of background noise. And so my guiding principle has been to see what everyone else has seen, but to think what no one else has thought. And this was a famous quote by the 1937 Nobel laureate. This was the guy who discovered vitamin C. So no matter what imaging modalities you use, this is a SPECT scan from Daniel Amen. And so he's got the world's largest database of SPECT scans. But what the SPECT scan shows is really a nice contoured brain in this particular example, means that there's sufficient blood flow to all regions of the brain. But if you look at an unhealthy brain, and these so-called holes tells us that there's dysregulation of blood flow or hypoperfusion to certain regions of the brain. This particular brain is the brain of a patient with an addictive disorder. And it would be the same if you had Alzheimer's or vascular dementia or Parkinson's or bipolar. There's a dysregulation of blood flow to specific regions of the brain, and that can be imaged through these SPECT scans. And this was just one example, but every single chronic disease is characterized by decreased blood flow to the affected organ and tissue. Layman, on account that if you can restore blood flow and perfusion to these specific tissues and organs, you can correct many, if not all, chronic pathological conditions. But the fundamental question is, how do you restore blood flow and perfusion to these select tissues, organs, and cells throughout the body? And that's where nitric oxide comes into play, because it is the molecule that's responsible for the regulation of blood flow to every organ, every tissue, and every single cell in the body. And this was the front page of the New York Times the day the Nobel Prize was awarded back in 1998, that the discovery of nitric oxide and its function is one of the most important in the history of cardiovascular medicine. I think, more than 22 years later, that statement still holds true. And I showed this complex slide here because prior to this study about 5 years ago, it was thought that nitric oxide is a vasodilator, meaning that it dilates blood vessels, opens up the blood vessels and the capillaries to increase blood flow and oxygen delivery to the cells. But this study here by Jonathan Stamler revealed that nitric oxide is actually required for the oxygen delivery when hemoglobin goes through this allosteric transition from the arteriovenous transit in the small capillaries. So without nitric oxide bound to hemoglobin, oxygen will not come off. Now, this becomes really important in critical care medicine, where you've got patients that are 100% oxygen or on 100% oxygen, especially in COVID. Their blood oxygen levels may be 98 or 99. The problem is they're systemically hypoxic because the oxygen will not come off until you restore the functionality of nitric oxide base. That's really a critical discovery in our understanding of nitric oxide. And it's even more pervasive than just in oxygen delivery. It's important in maintaining the integrity of the cardiovascular system, gut motility in the periphery. It's the molecule that tells our own stem cells to mobilize and differentiate. It's a neurotransmitter in the central nervous system, controls cell cycle, which has implications in cancer. It dilates the smooth muscle of the airways, so it has important clinical implications in asthma, COPD, emphysema. And it's the main molecule responsible for erections in both men and women. You need an increase in blood flow to the pelvic region to get and sustain an erection in both men and women. And then perhaps, very important now is in immunology, nitric oxide produced by our white blood cells is what's responsible for killing bacteria, shutting down their respiration, and actually inhibiting viral replication, which we know now in COVID, nitric oxide is really a very important component of getting sick from COVID. And in 1998, these three gentlemen shared in the Nobel Prize. Bob Furchgott, Louis Ignarro, and Fred Murad. I've been fortunate to work and collaborate with all of these. In fact, Fred recruited me to join the faculty of UT Medical School in Houston back in 2005. He was my department chair for a number of years, and Lou's written the foreword to several of my textbooks. So aside from all that, as a healthcare practitioner or a provider, you may ask, who needs nitric oxide? And this is kind of just a short list, but anybody who's aging, anybody over the age of 40, people with circulatory issues, diabetics, people with low energy, which is a mitochondrial issue, people with sexual dysfunction, anybody on antacids. Now, we've learned from Dr. Tennant that stomach acid is required for normal cellular function, but antacids also inhibit nitric oxide production. But I think medicine should be a proactive practice instead of a reactive practice. So I think we know that it's much easier to prevent disease than it is to treat it. So you need nitric oxide in order to prevent disease in the first place. And then anybody eating a poor diet, and stem cell therapy is a big deal now. So anybody who's getting regenerative medicine needs to restore their nitric oxide prior to deployment of stem cells. But if you go back to the basic fundamentals of cell biology, that a man is as old as his arteries, we can really illustrate that here, that when you're young and healthy, your body makes sufficient nitric oxide, and that prevents this plaque deposition and in the intimum or underneath this endothelium. But the older we get, the less nitric oxide we make, and then that really sets the stage for the inflammation, oxidative stress, and immune dysfunction that occurs in cardiovascular disease. And then the older you get, and if you have a lot of inflammation, this plaque ruptures, and that's a heart attack or stroke, the number one killer of men and women worldwide. So if you can prevent this age-related loss of nitric oxide production, you can prevent cardiovascular disease, heart attack, and stroke. And that's what I hope to share with you this evening on how to employ simple strategies to do just that. The first steps in cardiovascular disease is when monocytes, T cells, and neutrophils begin to stick to the lining of the blood vessel. They'll migrate through or extravasate, and then that elicits an immune response. So this is the inflammation and oxidative stress that occurs in vascular disease, and this is the immune dysfunction. You elicit the modified LDL as you start foam cells, and this causes the lesions. And then if the inflammation continues, that lesion then ruptures, and you get a heart attack or stroke. And so I'll show you, we've been able to capture this in real time through intravital microscopy. And if the video plays, if our streaming is good, you can see here, this is on a 6 weeks of a really inflammatory diet, a really poor diet, like eating McDonald's 3 times a day. As you can see here, there's a roadblock here. There's a number of cells that are immune cells that have stuck to the lining of the blood vessel. There's actually a number of cells that have already migrated through. So this is a heightened state of microvascular inflammation. Now, if we give that same inflammatory diet, but we basically fix the nitric oxide production in the endothelium, you can see the blood vessels more dilated. These immune cells home along the endothelium, but they don't stick and they don't migrate through. So even if you eat a bad diet, if you employ these simple strategies to restore nitric oxide, you can prevent the inflammation that occurs from a poor diet. And this, unfortunately, is what we're all faced with. This is the average of 4 independent studies looking at endothelial function with age. And so we lose about 10 to 12% of our endothelial function or nitric oxide production per decade. By the time we're 40 years old, we only have about 50% of the nitric oxide we had when we were younger. And this really, I've passed this so-called age of 40 by several years. And this is the age that people feel the effects of aging. You don't perform as well as you did on the athletic field, in the boardroom, or even in the bedroom. 50% of the men over the age of 40 self-report erectile dysfunction. And I think the numbers are much larger than that because most men aren't going to self-report some type of sexual dysfunction. But the point is that we get to see the clinical effects of loss of nitric oxide production. And that presents as high blood pressure, erectile dysfunction, vascular dementia, diabetes, peripheral artery disease, small vessel disease such as Raynaud's or ischemic non-obstructive cardiac disease, atherosclerosis, blood clotting disorders, acute respiratory distress syndrome, heart failure, kidney injury, and immune dysfunction. So these are the clinical presentations of a patient that's deficient in nitric oxide. Now, let me move to the immune function of this. And this has been known for many, many years. These are basic pathology textbooks taught to first or second year medical students. And it's appreciated that well-vascularized tissues are more resistant to infections and capable of localizing and containing these offending agents, including bacteria and viruses. By contrast, poorly vascularized tissues are relatively inefficient in responding to inflammatory stimuli. So these poorly vascularized tissues, such as a diabetic wound, are prone to infection and poor healing response. Now let's move to COVID because we're, a year into this worldwide pandemic? And this was a study I pulled, I think, from April or March of 2020, so almost 10 months ago. And even 10 months ago, it was recognized that if you had underlying cardiovascular disease or previous cardiac injury from a heart attack, that you had about a 10-time higher risk of death if you had COVID. And all of these underlying comorbidities now can be explained by lack of nitric oxide. And even in 2005, it was published that nitric oxide actually inhibits the replication of coronavirus. So we've known this for more than 15 years. So now if you think about this, if you're a patient that has insufficient nitric oxide production and you're exposed to COVID, you're compromised in your ability to generate nitric oxide to prevent the replication of the virus. The virus takes hold in primarily the sinus epithelium, rapidly replicates, goes throughout the body, and makes you deathly ill. But if you can make nitric oxide, then you prevent the coronavirus replication and prevent the progression of disease. The other alarming statistic is that the health disparities of African Americans, Blacks have a 2-time higher rate of infection, almost 4-time higher rate of hospitalization, and a 3 to 10-time higher death rate, depending on which reports you read in Chicago, for example, they have a 10-time higher death rate than any other population. African Americans only make up 13% of the US population, but they account for over 50% of COVID deaths. And to me, this is very obvious because we've known for many decades that African Americans have a higher incidence of high blood pressure, diabetes, end-stage renal disease, heart failure, stroke, heart attack than non-African Americans. And this can be explained by loss of nitric oxide. They're both genetic and environmental components that basically render African Americans deficient in nitric oxide. So no wonder they're suffering from a higher incidence of COVID infection, the rapid progression of disease, higher hospitalization, admission to the ICU, and death. And so we set out to change this. So we've got an FDA-approved investigational new drug to do a clinical trial in African Americans 50 to 85 with at least one underlying comorbidity, diagnosed within 72 hours. So we want to get these patients at the time they're diagnosed, implement our nitric oxide therapy before the disease really takes hold, and look at the rates of hospitalization, ventilation, and death. And so we have now 840 patients. We started this trial back in November. It's a multi-center, double-blinded, placebo-controlled study, and looking at remote monitoring with a pulse oximeter, measuring temperature and blood pressure. And this is results from a COVID patient that was suffering from silent hypoxemia, blood oxygen saturation of 79. We give them the COVID drug, and 5 minutes later, we've increased their blood oxygen concentration to 91. So that shows you the effectiveness of improving nitric oxide on blood oxygen concentration. You can see here there's a little bit of tachycardia because with this, the implementation of the drug, because there's improvement in perfusion, an acute drop in blood pressure, which is compensated by an increase in heart rate. But within 10 minutes, the heart rate is back down to normal. So we've enrolled, I think, between 50 and 60 patients. We haven't seen any unsafe drop in blood pressure, no adverse events, no issue with tachycardia. So the data are looking very promising. And I just want to show you a video here because we just created this animated video, but really tells you about the clinical trial, but also the biological effects of COVID, not only the increased rate of the rapid progression of disease, but now we're having these so-called long haulers, people who are having blood clotting disorders, increased risk of heart attack, stroke, long after the active infection. And so I'm just going to play this video.
Here's why. SARS-CoV-2, otherwise known as COVID-19, infects people by attaching to the H2 receptor, which is expressed in the lungs, but most importantly,
we're not seeing it on our end, Nathan.
You're not seeing it?
We're just seeing the link.
Then what I'll do, Janice, I'll send you a link, and then we can...
you put it in the chat? If you put it in the chat, people can grab it too.
Okay.
But I will absolutely put the link in the toolbox.
Okay. I'm not sure if I know how to do that. Let me just send it to you. I'll put the link at the very end.
Okay.
That's okay. So just moving on then, just to reiterate the point that nitric oxide deficiency causes cardiovascular disease, the number one killer of men and women worldwide, and increases sickness and mortality from not just COVID infection, but influenza, any viral infection. The same people that are susceptible to COVID infection are the same people that are susceptible to seasonal influenza for the past 50 years. This is really nothing new. I think it's been blown way out of proportion. But that's probably a topic for another day. So moving to diabetes, obviously another worldwide epidemic. Many people with diabetes, and we've known for many years that once you get diabetes, that this decreases nitric oxide production, and that basically explains the increased cardiovascular disease severity from diabetic patients. Patients typically don't die from diabetes, they die from the cardiovascular complications of diabetes. And then this study from probably 20 years ago, if you knock out the nitric oxide synthase gene in mice, their first phenotype is type 2 insulin-resistant diabetes. So this told us that if you become nitric oxide deficient, this may lead to diabetes. And then once you get diabetes, it further suppresses nitric oxide production. And that's why these patients are so poorly managed, because there's no anti-diabetic drug that's restoring nitric oxide production. And so again, we set out to change that. And this is a very complicated self-signaling diagram here, but we were interested to try to figure out where is nitric oxide playing in insulin signaling. And so for those of you that remember some basic biochemistry, when insulin is secreted, it binds to an insulin receptor, and then this starts a signaling cascade of tyrosine and PI3 kinases that then turn on AKT and AMP kinase, which is the target of metformin. And then these both converge on the nitric oxide synthase enzyme. But we know in diabetics that this enzyme is dysfunctional and doesn't make nitric oxide. But really, this is where there was a gap in the literature, because the terminal step is gluten-free translocation to the membrane where it binds glucose and internalizes it. So we actually discovered the mechanism of this. We published it in 2014. But there are two cysteine residues that can be post-translationally modified, and that signal is sufficient for gluten-free translocation. So if you just increase nitric oxide production in your diabetic patients, insulin signaling will improve, glucose uptake will improve, fasting glucose, fasting insulin will both improve. And we've seen this both in preclinical and clinical studies. So then the fundamental question is, how do you control and regulate nitric oxide production? There's two pathways that have been discovered. The first one was through L-arginine, but this really becomes dysfunctional with age. Your body loses the ability to convert arginine, so giving more arginine really does no good. And then the more recent nitrate, nitrite, nitric oxide, where you can utilize this pathway primarily through dietary means, eating green leafy vegetables or beets, to provide a source of nitrate or nitrite. So how do you improve nitric oxide in patients to restore blood flow? And are there products that have been shown to actually do this in clinical trials? So I tell people, look, the first things you need to do is understand, either you or in your patients, what are they doing to disrupt nitric oxide production? First, you have to stop them. So the number one disruptor is antiseptic mouthwash. There are 200 million Americans that wake up every morning and use mouthwash. And you have to stop this. We've published a number of studies showing that using mouthwash causes your blood pressure to go up. You actually lose the cardioprotective effects of exercise if you're using mouthwash. So you're killing off the bad bacteria, but you're also killing off the good bacteria that are responsible for generating nitric oxide. If you're on an acid, you have to stop. These are very dangerous drugs. These drugs were never approved to be used chronically. But yet now you can go to the drugstore and get these once daily Prevacid OTC, Prilosec OTC, and take them for the rest of your life. No wonder we're sick. You can't break down proteins into amino acids, and it's shutting down nitric oxide production. People that have been on antacids for 3 to 5 years have about a 30% higher incidence of heart attack and stroke. That's explained by disruption of nitric oxide. And then stop eating high carbohydrate, highly processed junk food. This leads to glycation of the enzyme that makes nitric oxide. So simply stop doing these three things, you'll see an enormous benefit in your health. But then if you want to go a step further, do the things that promote nitric oxide. Eat more green leafy vegetables, get moderate physical exercise, infrared light therapy or infrared sauna. I sit in an infrared sauna every day. And then, we've developed the Neo40 and other nitric oxide technologies that are patented, clinically tested, and clinically proven to restore nitric oxide. This kind of hammers home the message that there's problems in the pathways that become disruptive. So number one, if you don't eat enough green leafy vegetables, you're not getting enough nitrate in your diet to generate any nitric oxide. 200 million antacid users, 200 million antiseptic mouthwash. That's more than the U.S. population. Obviously, there's a lot of people that are using PPIs, antiseptics, overusing antibiotics that completely shut down. These are the patients who really do the poorest. So these are kind of the milestones we set for ourselves if we were going to develop a nitric oxide-based technology. Number one, if your body can't make nitric oxide, then we have to do it for you. And number two, understand the enzymology to the extent that we can actually fix the underlying problem of the body's ability to make nitric oxide. Account for differences in non-responders. Plant-based natural product chemistry is always important because there's nothing synthetic. Clear product experience, strong and sound basic science, clinically proven and peer-reviewed placebo-controlled trials. And then intellectual property is always nice to have because it prevents others from doing what you've done. And these are the clinical trials from Neo40. You can see here that as you put the lozenge in your mouth, we can detect actual nitric oxide gas coming out of the oral cavity. We see peak plasma concentrations within 20 minutes. This is a hypertension study. You can see within 20 minutes of taking the lozenge, you see about a 4 to 5 millimeter reduction in both systolic and diastolic blood pressure. And by the way, that's usually the best response you get from prescription antihypertensive medication on monotherapy is about a 4 to 5 millimeter reduction. But 60 minutes later, you get a further significant reduction in both systolic and diastolic blood pressure. Placebo, there's no effect. And then 4 hours later, we basically improve the body's own ability to make nitric oxide. So 4 hours after that lozenge put in your mouth, that nitric oxide is completely gone, but we've actually recoupled the nitric oxide synthase enzyme, and we improved the body's own ability to make nitric oxide by 15% within 4 hours. And then another cool technology is you can use ultrasound of the left common carotid. And so this is a baseline. You can see the internal luminal diameter of 0.52 centimeters. 10 minutes after the lozenge, the carotid is dilated to 0.6 centimeters. And this 13% increase in vessel diameter causes a 34% increase in blood flow. So if you want to increase blood flow to the brain, what better way to do it than to dilate the carotids? And then this was a pre-hypertension trial. We enrolled 37 patients, gave them one lozenge twice a day for 30 days, and we reduced their blood pressure by 12 millimeters systolic, 6 millimeters diastolic. So we took 37 pre-hypertensive patients in 30 days, we made them completely normal tensive. No change in heart rate. They were able to walk significantly further on a treadmill on a 6-minute walk test, and a quality of life questionnaire with both a physical and mental composite score. The patients taking the Neo40 had a better quality of life. This is thermography. This is a patient with Raynaud's syndrome. You've probably seen these patients that have almost necrotic black fingertips from poor perfusion, cold hands, cold feet. 10 minutes after the lozenge, you can see here that we've opened up the microcirculation and perfused the digits. Another published study looking at carotid plaque. So these are patients who had a stable carotid plaque for the previous 6 months. Put them on Neo40 twice a day, and within 6 months, we had 11% plaque regression in their carotid. And then this is a really interesting story at Texas Children's Hospital in collaboration with Baylor College of Medicine. There's a group of these pediatric patients that have an inborn error in metabolism, and they're born without an enzyme called arginosuccinate lyase, which is ASL. So this is part of the urea cycle. Without getting too technical, they get a buildup of arginosuccinic acid, and that's their basis of diagnosis of arginosuccinic acid urea, or ASA. It's a very rare disease, but it's a very serious disease. These kids develop hyperammonemia. They'll typically have to have a liver transplant at 7 or 8 years of age, or they'll die of liver failure and cirrhosis. But even though they're medically managed pretty well now with drug therapy and diet, they were developing blood clotting disorders. They had neurological dysfunction that was independent of the recurrent hyperammonemia. And a 5-year-old kid had high blood pressure and kidney disease. So they approached me to try to figure out, was this more than a urea cycle disorder? And we published this in Nature Medicine in 2011. But we discovered a new protein complex that this ASL enzyme tethers the enzyme that makes nitric oxide to the membrane. So in these patients that don't have this enzyme, they can't make nitric oxide. And it's the best human genetic model of complete nitric oxide deficiency. And it explains every single symptom that was previously undescribed or unexplained based on their clinical presentation. And so this is the lifelong blood pressure profile of this one kid at 5 years of age. He was diagnosed and he had high blood pressure. And he was very poorly managed, even though he was put on triple antihypertensive therapy for 10 years. And in February of 2010, he came to Texas Children's Hospital and put him in the intensive care unit with a blood pressure of 185 over 115. No medication that they gave him would lower his blood pressure. At that time, we realized it was a nitric oxide issue. And so the clinicians dosed him with isosorbide, which is an organic nitrate similar to nitroglycerin. And within 4 days, his blood pressure came down and he was released from the hospital. But a year later, he came back, February of 2011, taking 20 milligrams isosorbide 4 times a day. And his blood pressure was 185 over 110 when we saw him. And we started him on the Neo 40. We made a special Neo 40 lozenge for him. And within 4 hours, his blood pressure completely normalized. And we got him off all prescription medication. I think this was, we're almost 10 years out. Now the kid's off all prescription medication. He's done very well. He had a heart twice the size of a 15-year-old. But within 5 months, we had normalized his heart function, remedied his heart disease is completely resolved. His kidney disease resolved within 5 days. Heart disease resolved within 5 months. And let me take you quickly through some cool technology. This is a non-invasive, non-ischemic plethysmography called pulse wave analysis. And what we're looking for here are type 1 and type 2 blood vessels. That means that your blood vessels are soft, compliant. They basically comply with each beat of the heart. They dampen that pulse wave. But if you have type 4 or type 5 blood vessels, you've got a stiff artery. It's plaque-ridden. So with each pulse or each beat of the heart, that pulse wave travels really fast and causes damage to the lining of the blood vessel. So we've now collected hundreds, if not thousands, of patients on this. But this is a 70-year-old female. Started out with type 5 blood vessels. And then within, 60 days, we converted her to type 1 blood vessels. And so then we've seen this over and over again. Within 60 or 90 days, you can completely reverse type 4, type 5 blood vessels and turn them into type 2 and type 1 vessels. And then let me move to the topical, because this really captured my attention many years ago, treating my dad's decubitus ulcers. My dad's a paraplegic from a car accident in 1984, so we dealt with pressure ulcers for decades. I learned how to treat wounds when I was 10 years old. But early in my adult academic career, we started making a nitric oxide generating gauze and found that would kill an infection and basically cause increased blood flow and actually heal the wound. So I thought, well, this has some pretty important clinical utility. So rather than going through not wasting the time, but spending the time to do an FDA-approved clinical trial, we brought this to market as a cosmetic. Because if you think about it, aging skin is just like any other organ. It's the loss of blood flow. And when you have loss of blood flow, cells don't regenerate. You get loss of collagen, loss of hydration, and that's fine lines and wrinkles and the aging process. So we developed a dual-chamber nitric oxide generating skin serum. And Janet showed you that earlier. We call it Nume, or the breath of life. But these are the clinical trials for this. You can see this is using the serum twice a day for 30 days. The age spots disappear. The neck, we call this lady, she's a 55-year-old lady with, we call it turkey neck. You can see the inflammation's gone, the fine lines and wrinkles improve. The varicosity improves. Wound healing, this is a lady post-facelift, went home and started smoking. So we applied the serum directly to the wound, and 10 days later got complete closure. Acne, very effective in acne. It's not only antimicrobial, kill the acne-causing bacteria, but it increases blood flow to the surface of the skin. It basically allows your immune system to do what it's designed to do. And this is a 13-year-old girl. This is 3 days. The other was 30 days. And it's agnostic to skin type and skin color. It works in Caucasians, African Americans, Hispanics. Nitric oxide is agnostic race. So let me just wrap up here by answering some very important questions, because people send me products, people email me about, does this product work, does this product not work? And I've tested every single one of these. And you're confused, I'm confused. So this is just a snapshot of, if you go to your local pharmacy or health food store, of what you can get over the counter. And all of them say the exact same thing. So how do you know which product works? Well, number one, just because a product has beet in it doesn't necessarily mean that it's generating nitric oxide. 95% of the beet products out there have no nitrate in them. The only thing they do is turn your pee and your poop pink and give you a little bit of anxiety. They have no biological activity whatsoever. Nitrate, there's a nitrate product out there that doesn't equal nitric oxide. You can't convert it if you use antiseptics, antibiotics, or antacids. Then arginine, citrulline-based products do not work in patients with endothelial dysfunction. So what do you look for? Look for issued patents on products. If there's patents, it means that there's innovation and uniqueness. And ask the company that manufactures this if there's published clinical trials in peer-reviewed journals. If a product actually generates nitric oxide or improves nitric oxide, then it will show improvements in patients, and you should be able to demonstrate this in clinical trials. The clinical trials are very expensive and time-consuming. Most companies don't go through the trouble of it because they know their product won't work or show any improvement, and it's just a waste of money. Look for products that are licensed from a reputable university or institution. And then, is the inventor, a product developer, an expert in the field? I'm invited to webinars all the time with people who are pitching a nitric oxide product, and then I do a PubMed search, and they've never published a single paper in nitric oxide. It's complex. How can you develop a safe and effective product if you don't know anything about nitric oxide biochemistry? So the take-home message is, don't be fooled by creative marketing. Science and expertise matter. And then these are kind of some biohacking protocols for immune protection now that maybe we're on the downslope of COVID. I don't think COVID's going away anytime this year, but I think in a couple of years it'll be in the history books. But during this time, I don't want to trivialize this, because in some people, it makes them very sick and people are dying from this. And I think what's clear to me is that if you're otherwise healthy and your body can elicit a robust immune response and nitric oxide, I'm in COVID clinics every day. We've got 6 trials going on in the U.S., around the U.S., and I haven't been sick. I got tested for COVID antibodies, and I'm negative for COVID antibodies because my body makes sufficient nitric oxide that even though I'm exposed, the immune system takes care of it. So take 1 lozenge twice a day, 1 in the morning, 1 in the evening, and then apply the serum really on the face twice daily, under the nose, on the eyes. That's where transmission occurs. And nitric oxide can inhibit the coronavirus replication. So I'll just end with concluding that nitric oxide controls and regulates vascular structure and function. There's an age-related decline in NO production that asserts its effect on cardiovascular risk and chronic disease. Restoring NO production is critical. And I think hopefully I've given you some clinical pearls that you can use to improve your own nitric oxide production.